How many of you are taking a supplement of any sort? Or if you're a prescriber, think about your patients. How many of them are taking over-the-counter supplements such as vitamins, minerals, botanicals? Quite a few. In fact, in the United States, about 75% of adults take some sort of supplement, and probably more coming. Now, here's the question I think we should be asking more often. We're just not really paying a ton of attention to magnesium. How many of our patients are actually deficient in magnesium, and we're just not looking for it? So magnesium, it really is often an overlooked mineral. I'm going to talk about a bunch of things that I use for my patients every day, and I even use for myself and for my family. So magnesium, underappreciated nutrient medicine, it's not glamorous, but it can influence so many things like sleep, anxiety, cognition, mood, chronic pain, metabolism, metabolic health, and even long-term brain aging. I'm Dr. Arwen Podesta. I'm a psychiatrist, and here we are breaking down mental health, brain science, and integrative strategies in a way that's practical and grounded in evidence, whether you're a clinician working with patients or someone trying to better understand your own mental health. So what the heck is up with magnesium, and why does it matter? Well, it's the second most abundant intracellular cation after potassium. It serves as a cofactor in over 300 enzymatic reactions all throughout the brain and body. ATP production, neuronal signaling, muscle contraction, protein synthesis, glucose metabolism, and regulation of NMDA receptors. And unfortunately, this isn't just biochemistry, because it really is that compounded problem because of the declining mineral content in some agricultural soils, because of GI disorders and medicines like PPIs and diuretics. We really do have a perfect storm for inadequate magnesium status. For those of us treating people with psychiatric needs, people with addiction, people with cognitive disorders, magnesium becomes very interesting. It plays a really major role in those systems that we've already talked about, some, the NMDA, glutamate receptor regulation, neuroplasticity, who doesn't want lots of that? Stress response, we want to have really good stress responses without feeling drained or depleted. BDNF is brain-derived neurotrophic factor. Great stuff. We want more of that. Magnesium is involved in BDNF production, not the only thing, but one of many, many things. Memory formation, it's so important. And adequate magnesium appears to support learning and hippocampal function while helping regulate excitatory neurotransmission, so stress response. There's even observational studies that look at it in magnesium intake compared with folks with lower magnesium intake in relationship to cognitive decline and dementia. So we need to pay attention to that as well. So clinically, how do I think about magnesium? What do I consider attending to magnesium in my patients? Honestly, almost everybody walks away with one of their very first things after they first start seeing me is probably going to be magnesium, unless they're already taking it. So patients with any sort of anxiety, with insomnia, with chronic stress, migraines, chronic pain, muscle tension, metabolic dysfunction, those recovering from substance use disorders, all of those things have magnesium associated with them. Now, it's not a magic treatment. It's not like you're going to take magnesium and suddenly all of those things are going to go away. But when a patient is very deficient, correcting that deficiency can certainly improve overall nervous system regulation and help optimize the other things that we're doing as well as clinicians, or the other things that the individual is doing. I do want to mention that, we get magnesium on regular lab batteries on your complete metabolic panel. But the thing is, it doesn't show, if you're very deficient in magnesium, it might not show up in your blood yet. So that doesn't necessarily have such a strong association with magnesium deficiency when it's causing symptom manifestation. Okay, so now we know magnesium is important in all of these symptomologies and all of these pathways. But what do we do about it? Well, you walk into your grocery store or your vitamin store, or you look online, or you get influenced by some social media posting, and it's overwhelming, right? Clinicians are overwhelmed, doctors and nurse practitioners and PAs and nurses are all overwhelmed about this. Patients walking into the pharmacy and seeing all these different forms, it's overwhelming. And the reality really is they're not interchangeable forms. Magnesium oxide and magnesium citrate have relatively poor systemic absorption. But that's helpful when you're trying to treat chronic constipation or treat any sort of constipation, because much of their magnesium stays in the gut. But for brain, for me as a psychiatrist, the ones that I think about are the bottom two here: magnesium bisglycinate, which is also known as magnesium glycinate. It has great bioavailability, meaning it's absorbed easily. It's also gentle on the stomach. And interestingly, the glycine part of it, that component can provide additional calming and sleep supportive effect. The other one, which is called magnesium L-threonate, that was actually developed specifically to increase magnesium levels within the central nervous system. And a lot of the data is showing much improved cognition, which is amazing, and increased IQ is what it's being touted for. So those are the two that I focus on, is the bottom two: magnesium bisglycinate and magnesium L-threonate. Okay, well, this is what I'm here for, right? So what do I actually recommend? Well, you know what? A lot of magnesium comes in food as well. So leafy green vegetables, nuts, seeds, legumes, whole grains. Let me ask you this: if you have a craving for something, I have patients that say, oh, I crave almonds all day long. And that might be that their body is trying to tell them that they need to eat something. I also need to go on top of that, because not everybody has the ability to eat all of these beautiful whole foods all day, every day, right? So we supplement. We supplement a little bit here and there. And I usually individualize dosing depending on what people's diets tend to be like, and depending on what their symptoms that they show up to me with. And then we, also thinking about what medicines they're on and GI tolerance as well. So my practical approach is gradual titration. Start 1 pill a day of whatever dose it is. They're usually coming in a formulated dose, 100 to 120 milligrams, and increase that dose every few days until someone gets to bowel tolerance, which means that the stools are noticeably looser than comfortable, and then reduce back down. And that usually identifies a reasonable maintenance dose for the individual. Of course, severe deficiency or hospitalized patients might actually require IV replacement, which is an entirely different clinical scenario, but I certainly refer and have colleagues that do IV magnesium replenishment as an outpatient, and I think it's a very valuable tool. All right, I want to leave you with 3 practical take-home points. Number 1, magnesium deficiency is very common, especially in older adults, but also in tons of people with chronic disease. Second, if you're recommending magnesium, or if someone has recommended that you take magnesium, choose the formulation based on your goal, your clinical need. Because constipation treated by magnesium oxide or citrate versus brain and cognitive enhancement treated by magnesium bisglycinate and magnesium L-threonate, very different, right? They're not treated with the same magnesium product. And finally, magnesium, it's not a cure for psychiatric and neurological illnesses. It's not a cure for muscle diseases, but it is one of the foundational pieces of biochemistry, of the biology, of the physiology that we as clinicians and individuals overlook very frequently while we're searching for medicines or more complicated solutions. Sometimes improving brain health just starts with correcting the basics. So thank you so much for paying attention to this, and I look forward to seeing you again.